Hello, this is going to be an introductory lecture on the Care Certificate. So what is the Care Certificate? The Care Certificate is an identified set of standards that health and social care workers adhere to in their daily working life, designed with the non-regulated workforce in mind. The Care Certificate gives everyone the confidence that workers have the same introductory skills, knowledge and behaviours to provide compassionate, safe and high quality care and support. The Care Certificate was developed as part of the Cavendish review work jointly by Skills for Health, Health Education England and Skills for Care. Why has it been introduced? Following the Francis inquiry, which was into the Staffordshire hospital scandal, Camilla Cavendish was asked by the Secretary of State to review and make recommendations on the recruitment, learning and development, management and support of healthcare assistants and social care support workers. The resulting report, published in July 2013, found that the preparation of healthcare assistants and social care support workers for their roles within care settings was inconsistent, and one of the recommendations was the development of the Care Certificate. So it applies to all care assistants who start work from the 1st of April 2015. The care assistants must be signed off as competent in 15 standards to be awarded a certificate. It is expected that full-time staff would take 12 weeks on average to complete it. So this 12 weeks was when it was expected that paper workbooks would be completed. So it's now, since we've been using an online platform, this is significantly faster for staff to complete. Other staff can be mapped in at a later date. This is talking about staff who had MVQs, BTECs, etc. However, it was still faster for those staff to complete the online training component. It does form the majority of induction training. However, the Care Certificate is generic and covers all types of care places. So everything from domiciliary to acute hospitals, care homes, etc. So there would still need to be some specific induction training, such as end of life or pressure sore prevention. The standards are: understand your role, your personal development, duty of care, equality and diversity, work in a person-centered way, communication, privacy and dignity, fluids and nutrition, awareness of mental health, dementia, learning disabilities, safeguarding adults, safeguarding children, basic life support, health and safety, handling information, infection prevention and control. Assessment strategies differ depending upon which part of the Care Certificate is being undertaken. The guidance document sets out what must be assessed and how it should be assessed. Most assessments should be within a setting where care has been provided to service users or patients and should be completed face-to-face. More information is contained in the Care Certificate Framework Assessor document. Learners can practice and develop their new skills in a classroom skills lab or similar setting, but the assessment evidence must be collected during real work activity. So this is how the online component will be how staff are learning and being assessed, but the majority of the competency assessment will be observation in the workplace. There will also be separate training for basic life support with assessment, and the same for infection control. There will also be a personal development plan to complete, so that would all collectively contribute towards the assessment. So who can assess the competency of care assistants? The employer must be satisfied that the assessor is competent to assess whether the worker meets the standards of the Care Certificate. The assessment, including observing someone and assessing their competence, must be undertaken by someone who is occupationally competent, which means someone who has the necessary experience to judge whether the learner has demonstrated the required competences. The guidance does not specify that someone delivering the training and carrying out assessment needs specified qualification. The assessor does not require a formal assessor's qualification. The employer has to be confident that the assessor is competent to assess. For example, a registered nurse deemed competent by the registered manager in the standard can assess that the care assistant is competent in that standard and then sign them off. So training, supervision and assessment of competence. So health and social care employers will still need to provide appropriate practical training, supervision and workplace assessment, and these cannot be covered by a workbook. It is the responsibility of each health and social care employer to judge the competency of their workers and arrange additional training, support and supervision as required. The home will provide training, study materials, mentoring and supervision to ensure care assistants can demonstrate competency. This includes additional support if not deemed competent at the first assessment. Quality assurance. The employer is responsible for assuring the quality of the teaching assessment of the care certificate. The registered manager in adult social care or named person in the health employer will sign off the healthcare assistant as having successfully met all the standards to achieve the care certificate. The registered manager or named person must assure themselves that the standard of teaching and assessment is of sufficient quality that they can be confident that the healthcare assistant has fully met the standard. The outcomes of the care certificate will be quality assessed via the CQC's existing methodology in reviewing its essential standards. So the Care Quality Commission. In our guidance for providers on how to meet regulations, we are explicit about our expectation that those who employ healthcare support workers and adult social care workers should be able to demonstrate that staff have or are working towards the skills set out in the care certificate as a benchmark for staff induction. Reference to the care certificate is made in our regulation, in our guidance to providers under Regulation 18 on staffing and Regulation 19 on fit and proper persons employed. So effectively, the CQC is providing quality assurance for the provision of the care certificate. And once you've completed those standards and been signed off as competent in them, you'll be awarded a certificate by the employer. It will be signed by the registered manager, and it's transferable to a new employer such as an NHS acute hospital. The certificate will have a standardized format. It can be have the logo of the organization put on it as well, but it will look the same wherever it's awarded. That's the end.